Nurse Alice Benjamin is joining us. She's also known as America's favorite nurse.
We have to be careful because this will open the floodgates and open Pandora's box.
Not only is the beet good at helping to bring your blood pressure down, this is nature's Viagra. What I really want viewers to know is don't throw your coffee cup away just yet. It's really important that we as healthcare professionals take the time to decontaminate these things. When it comes to pancreatic cancer, it's the fourth leading cause of cancer death.
And stage 4 is basically the most advanced stage of cancer.
Hello, friends, and welcome to Nurse News Now with Nurse Alice, courtesy of nurse.org. I am so excited that you joined us. We are actually streaming live on nurse.org's Facebook, as well as we have our peeps on Instagram who are joining us here on the side. I'm really excited for today's show, and I think you will be as too, because you know what? We as nurses are here on the front lines. We've been on the front lines since the beginning of COVID-19 pandemic. And now we are going to be some of the first and have been some of the first, the people to receive the COVID-19 vaccine. And I understand, guys, there are definitely some mixed feelings about the vaccines throughout the nursing community. And it's normal to feel concerned and to have questions, especially with so many advancements, updates, and changes surrounding COVID-19 and the vaccines. And being frontline healthcare staff, we really want you to feel confident and informed when you're talking to your patients, because I can guarantee you, your patients, your neighbors, your family members, your friends, everyone's asking you about COVID-19, all the different stories that are floating around there on the news, and they're asking you, should I get the vaccine? Is it safe? So this forum, nurse.org and myself decided that we needed to have a weekly forum where we could talk amongst nurses and empower and educate one another so you can feel confident with the information so you can provide to your patients about things that are going on. So we're going to consider this a tool to keep us current with all of the changes and things that are happening. And again, one of the most important things is we want you to feel comfortable. We want you to feel confident when talking about COVID-19, the vaccines, and any other related matters. So we're going to do our best, right, to talk about these stories and to clarify things. So we have a great lineup of topics that we're going to talk about this evening. But before I get there, I really want to first thank nurse.org for allowing us to have this platform. You know, aren't they the best? They are really the best, guys. If you haven't already, it's very important. You need to visit their website, visit nurse.org. I mean, not to mention things with COVID and vaccine, but if you have questions about nursing school, you have questions about student loans, you want to know how to be a pediatric nurse practitioner, anything you'd want to know about nursing, you can visit nurse.org and get information there. And as well, make sure to follow them on social. They're on IG and Facebook. I have their social media handles there, so please make sure to follow them. And let me say this, as your host, I'm Nurse Alice. I am a board certified cardiac clinical nurse specialist and family nurse practitioner. I have spent about 23 plus years in acute care, mainly critical care, ER, trauma, and those type of things. And I'm a medical correspondent for NBCLA. So I am very used to having these conversations. And I know sometimes it can be very charged, but I want to encourage you and inform you that this is a place where we can have safe conversations. We do not tolerate any bullying or any hate speech. So I just want you to know that yes, I do have the ability to boot you from the live if those are the type of comments that come up in the feed. But while you're watching, while you're listening, I know you got questions already about COVID and vaccines and other things. Go ahead and drop those in the comments, because while we have a full show of different topics, rest assured, we're going to get to as many of your questions as possible. And then as well, we have a bonus. We have some NCLEX questions that we're popping in there for our nursing students, because this is a show for people who are pre-nursing, who are in nursing school, for people who are new nurses, advanced practice nurses. Maybe you're a retired nurse. It doesn't matter. This is for you. We are one whole community. And the goal here is to empower you all with information and help educate you so you feel more comfortable and confident with having conversations with your patients. So make sure also to share, because sharing is caring. Make sure to start a watch party on Facebook. Share this with your friends and your family. And if you're on IG, hop on over to Facebook, join us so you can watch all the videos and see all the cool things that we're going to be displaying on the screen. And then if not, you can stay here and listen, and make sure to take that arrow, boop, Share it with your friends, your families, your colleagues, your teachers, and everyone else. Okay. So we are going to go ahead and get started. So this week on Nurse News Now, we are going to discuss several topics around COVID-19 and related matters, but these are the topics that have bubbled up to the top, and these are the topics that you had questions about. So our first topic is, why did a nurse faint shortly after receiving the COVID vaccine? So I don't know if you guys have heard this story, but a Tennessee nurse fainted after she received the COVID-19 vaccine last Thursday. Guys, you know, it's a little bit scary. We've been seeing the videos go around and circling, and people have been putting stories to this video image. And that's why that's a topic we want to talk about this evening, because one of our goals is to clarify all of the gossip that's out there, put that to rest, all the propaganda, all the rumors, and everything we're going to talk about is going to be based on science and evidence. It's going to be compassionate, it's going to be culturally competent, and it's going to be built on integrity, because that's who we are as nurses. So if you haven't seen that video, for those of you who are just joining us here on Facebook Live and you've heard the story, but you haven't seen the video, what I'm going to do is I'm going to go ahead and play the video now so you can see her. Her name is Tiffany Dover. She is a critical care nurse and manager of a COVID unit at a hospital in Chattanooga. Take a look here.
We are in the COVID unit, so therefore, you know, my team will be getting first chances to get the vaccine. And I know that it's really, I'm sorry, I'm feeling really dizzy. Oh, I'm sorry.
You guys, what a scary sight to see, right? There she was. She got her COVID vaccine. She was one of the very first at our hospital in her city to get it. And she wanted to talk to the news reporters about the importance of the vaccine, talk about how she was feeling. And unfortunately, she started to feel very faint shortly after the vaccine. Now, I'll tell you this, the stories that are floating on the internet are saying that she fainted as a result of the vaccine. Now, this is where we as healthcare professionals, whether you're a student nurse, a nurse, advanced practice nurse, or retired nurse, it's very important that we base the information that we tell our patients on science and research and things like that. And although I have not been personally someone who cared for Tiffany Dover, she did release a statement to the news, and this is what she said. She said that when she recovered, Tiffany said the reaction is not uncommon for her. I have a history of having an overreactive vagal response. And so with that, if I have pain from anything, a hangnail, or if I stub my toe, I can just pass out. So Tiffany was referring to a vasovagal syncope episodes that she has. So this is something that has happened to her before, and it happened to her again. So guys, you can imagine being, working in a COVID unit, a manager of a COVID unit, having to deal with so many issues, your staffing and your patients, and then as well being one of the first to receive a very new vaccine. That's scary in and of itself. And then couple that with having to be in front of cameras, talking to reporters about such a monumental event, that can add a lot of emotional stress, anxiety, and all of those type of things. Although, do we know if she had some discomfort with the vaccine? Don't know, maybe a little bit of pain, but I'll say this. Based on what Tiffany has shared with us, and based on what we know from the vaccines, there's no reason for us to believe that she passed out as a result of the vaccine, as if there was some type of reaction or chemical response or something in the vaccine that prompted her to pass out. And especially since this is pre-existing condition for her. So she has attributed and said that she has vasovagal syncope. So this is when you faint because your body overreacts to certain triggers, such as the sight of blood and extreme emotional distress, which I think she was under a lot of emotional distress. And let's talk about it. We see this in movies all the time, right? That the father comes into the labor and delivery room, he's watching the baby be born, and then they pass out. A lot of people pass out when they see the sight of blood. So it's not uncommon for things like this to happen. So this can also be called neurocardiogenic syncope. And so basically, the vasovagal syncope triggers can cause your heart and blood pressure to suddenly drop. And so this is what we believe to be the reason of why she passed out. It wasn't necessarily because of any component of the vaccine. And I think that's really, really important for us as healthcare professionals to understand and know that, so that when we're seeing stories floating around, when our neighbors or our classmates or people at the store are asking us, because when you're a nurse, they're going to ask you all kinds of questions, we can explain this to them. Okay. So that's something that we felt was very important to kind of, let's talk about the elephants in the room, because it's all on the news. It's all on social media. It's gone viral. So that's something that we wanted to talk about. Very, very important. So, and again, hello to everyone who's joining in. Thank you so much. Make sure to drop your questions and comments in the chat box. We're going to get to as many of them as soon as possible. We think this is a very important and timely conversation. And then for our folks on Instagram, hey, I'm so glad that you're here and you're listening. I wish you could join us and see what we see. So pop on over to Facebook and go to nurse.org on Facebook and check out Nurse News Now with Nurse Alice. But we're going to keep the conversation rolling. Okay. Another story that's floating out there, guys, that we gotta talk about. And I'll be honest, this next story, it was a little bothersome for me. I have to be honest. So I am going to go ahead and we're going to play this video. And I'll just say the question is, did a nurse attempt to administer the COVID vaccine with an empty syringe? So I'm just going to go ahead and play the video first, and then I'll talk about it more. But here, take a look.
Take a look at the original video in question. The UMC healthcare worker rolls up his sleeve and at first glance appears to receive dose 1 of the Pfizer coronavirus vaccine. But upon closer review, it appears as though the syringe is empty and no vaccine was injected. Now let's take a look at one of the other nurses receiving the vaccine for comparison. I've paused it right before the needle is placed in her arm. Let's zoom in and take a look. Notice this black line at the bottom of the plunger. You can see it move lower as the vaccine was injected. Moving back to the nurse in question, the black line starts already at the bottom of the syringe. But when I took this picture of the syringes before they were administered, it looks as though none of the plungers have yet been depressed.
Okay, y'all, what did you guys think of that video? I mean, that was rather interesting, right? And the part was, these were news reporters that took note of this situation. So just to kind of reframe everything, in case you didn't quite understand the video, on December 14th, 5 University Medical Center of El Paso staff were the first people in their county to receive the COVID vaccine. But after watching that live video, many reporters and viewers speculated as to whether one staff received only a portion or any vaccine at all. So you could see the video how when the nurse went to administer the vaccine, he was unable to push the plunger because, frankly, the syringe looked empty. It really looked empty. The nurse who administered the vaccine appeared to have inoculated the vaccine recipient with an empty syringe. And this leaves one to wonder, did he follow the 10 rights of medication administration, or was there any vaccine administration protocol used? So whenever we give medication, we know we have sometimes, I guess, depending on when you were at school, it was 5 rights and it was 6 rights and it was 8 rights and now it's 10 rights, right? But the point is that we are doing all of our safety checks to make sure that we have administered the correct medication, the correct dose at the correct time to the correct patient for the right reason at a minimum, right? Now, what I want to say here is, prior to the administration of the vaccines, the reporters took pictures of the nurse and 5 full syringes. The person that was in question, and he's not a nurse, his badge clearly says EMT paramedic, but he's in scrubs. So everyone who wears scrubs gets the label nurse, right? But this was the second person to get the vaccine. So I'm just curious. Let's walk through this, nurses. Y'all help me out. Join in the conversation. Let's hear what you got to say in the comment boxes, guys. 5 nurses. You got 5 full syringes. You got 5, let's just say 5 staff. First staff goes. Perfect, no problem. Second staff goes. They sit in the chair. The nurse arrives with an empty syringe to give the vaccine. First off, you should have checked your supplies before you do that, right? That's one of the things that's very important, right? Washing your hands, making sure you have the right medication and the right equipment. But this nurse seemed to just wipe the arm with alcohol and then just administer the vaccine, and then appears to toggle a little bit with the syringe when he recognized that he couldn't depress it, and then took it out, wiped his arm, and then went back to his corner as if to dispose of that needle and to get ready for the next person. I'm curious to know what you guys think about that situation. I'll just be honest, I was a little startled that once the individual recognized that they did not have a full syringe, or that there was an issue with the syringe, that they didn't say anything and that they just passed it on as if they had done the complete medication administration. So that is an issue of concern. My second issue of concern is, where did we get an empty syringe from? There's only been one other person in front. There should only be one empty syringe, and that would be a syringe from the nurse before. So could it be possible that this was a reused syringe? We don't know. And one of the reasons why you don't know is because when reporters reached out to the hospital to ask their response to the situation, the University Medical Center of El Paso released a statement, and this is what they said. They said, oh, and I think I have that up so I can share with you all what their statement is, so you can read it on the screen as well. Let me go ahead and put this up. There we go. The statement reads, let's go. After numerous reports emerged on social media claiming one of the 5 nurses receiving a vaccination on Tuesday did not receive a full dose of the vaccine, we want to remove any doubt raised that he was not fully vaccinated and further strengthen confidence in the vaccination process. The nurse in question today was vaccinated again. UMC has confirmed with the U.S. Advisory Committee on Immunization Practices that revaccinating the nurse will not cause adverse effects. The nurse will need to return after 3 weeks to receive his second dose. So what do you guys think about that? Any questions or comments in the chat box? Because I think there raises a lot of issues with that. Now, this is not a blaming game. It's not a shame game, but we do know that nurses are the most trusted profession and have been so per the Gallup polls for the past 18 years. So everything we do with integrity. We are trusted. So whenever there is an issue, it's very important that we self-report, that we, come forth with what's honest and what's true. And what seems to be true based on what we've seen and due to the lack of response from the hospital is that it doesn't appear that staff received a vaccine the first time. So to use the word revaccinate is misleading. I reached out to the university hospital to see if they had a response. News reporters have reached out to them for their response to ask more, but the hospital has not said anything. So all we could know at this point is that there's this video floating around. People are asking questions. It does feed to some of the concern and the mistrust that people have with the healthcare community, which is why it's very important that I felt that we needed to talk about this, address the elephant in the room, and talk about how do we prevent things like this from happening again. It's very, very important. And I think one of the ways that we prevent things like this from happening are we talk about it. We're transparent. We look at the process, because it's never one person, but what's the process? What was the process for administering vaccines that day? I think that's something we need to talk about. And then also being transparent with the public. Being transparent is extremely critical, especially with everything that's going on today. The public wants to know. They want to know more about the vaccine. And so we need to be transparent with not only what we say and what we do. And when mistakes, as they do happen, we need to be transparent with the public and talk about it instead of hiding behind, a press release. So there is that piece. So that was another story that we wanted to talk about. Hopefully we'll hear from that hospital very soon. But now I want to segue and I want to invite a special guest to the show. I'm really excited. You guys know this gentleman. You've seen him on television. You've seen him all over social media. He's definitely much a social media influencer. And I'm really excited. He is an acute care nurse practitioner and hospitalist at a large academic medical center, trauma center here in Los Angeles. I want you to please welcome to the show, Dr. James Simmons. Hey, Dr. James, how are you? Oh, he's on mute and he's going to take himself off mute in a second.
I'm on, you know what? That is the quote of 2020. You're on mute, right? I just had to, we might as well, 10 days left in 2020 or whatever. I got to be the guy that's on mute. Sorry about that. Alice, thank you for that introduction. I'm going to take you everywhere with me. You just introduce me every time I walk to the restaurant, to the grocery store, wherever.
Yes. Well, we're excited to have you. And I'm so excited to have you for several reasons. For one, I know you're amazing and awesome already. For two, you are someone who has already received your COVID vaccine. So we're going to be very interested to know what your experience is, walk us through the process, because many of us have not yet received a vaccine. So we're curious to know what that looks like. But first, we want to pick your brain, Dr. James. We definitely do.
All right.
So if you're on Instagram, please pop on over to Facebook. We're going to get into our NCLEX minute. We have some great NCLEX questions that we're going to pop up here. So, Dr. James, if you wouldn't mind, because much of our audience are nursing students or people who are continuing to study for boards, certifications, and things like that. So we like to toss in a question or two every once in a while. And I'm going to throw up our first question for the evening. And let's see, here it is. So our first question is, which of the following laboratory findings are suggestive of a COVID-19 infection? So guys, for those of you who can't see the screen, I'm going to say the answers. So our first one is A, elevated C-reactive protein, B, decreased white blood cells, C, RBCs in the urine, D, bilateral patchy infiltrates on chest x-ray, E, elevated procalcitonin levels, F, a positive SARS-CoV-2 ABIgG, or G, and there are some ABG readings there for us to go over. And for those of you who are not quite as ABG savvy, they're normal ABGs. Okay. So, Dr. James, you're our guest, but you're Dr. James. And also as a hospitalist, let me say this, as a hospitalist, you are on the front line treating people, admitting people with COVID-19. So this is something you see all the time. So for those of our nursing students and our nurses that are watching, this is a select all that apply question. So, and I just want to jump into it. Dr. James, let's hit this. Let's see what is and what isn't a suggestive laboratory finding of COVID-19. So I'm going to say A, elevated C-reactive protein is a yes.
Yes, A is correct. So you will see that because it's general, CRPs can be, C-reactive protein, CRP, can be elevated for a lot of different reasons. It's a sort of a general biomarker for inflammation, right? Well, COVID-19 is an infection. You are inflamed. So you're definitely going to see an elevation in the CRP with almost all COVID patients.
Yes. I like to ask that question. What's a C-reactive protein? And I think for some people, that's a newer one, but I learned that long time ago. A cardiologist told me long time ago, even if your troponins and everything looks negative, if you have an elevated CRP, that means there's inflammation somewhere in the body. And we got to figure out why that is. Okay.
Absolutely. And it is, let's use the right terminology. It is sensitive to inflammation, but not specific. It won't always tell us exactly where the inflammation is, but it will tell us that you're definitely inflamed.
There you go. Thank you very much. B, decreased white blood cell count.
I'm gonna let you guess first.
Well, I don't think that's the answer because we're used to seeing, although I know people are gonna say, but I've seen this, but for the most part, we generally see an increased WBC count when we have someone with a COVID infection, correct?
Yes, correct. You got it. It's an infection, right? And it generally manifests as pneumonia, at least to start. So you're going to see an increase in white blood cells. Now, you're not always necessarily going to see a huge increase. You can have someone who is quite ill and needs to be hospitalized and requires, management in the hospital with just a slightly elevated white blood cell count, but definitely. And in terms of for a test, I would say no, that you would not include B. You do not see a decreased WBC count in COVID.
Okay, and I'm going to say neither would you see RBCs in urine. We're not going to see that necessarily with COVID-19. That might be something else, but not COVID, right?
Correct. There are some there can be some renal impairment, some renal damage that goes along with with COVID. So, if there's maybe a coincidental concurrent sort of urinary tract infection, maybe you'll see some RBCs in there. But in terms of, so the answer for this is no. So C is no, you're not going to include that. But you also shouldn't necessarily be surprised if you see that, because there may also be something else going on. This person might have multiple comorbidities. So you might see the RBCs in urine, but it does not pertain to the COVID-19.
Gotcha. Okay, now I know these answers. D and E. Bilateral patchy infiltrates on chest x-ray, yes. And elevated procalcitonin levels, yes.
Absolutely. Both. That D is the biggest one. Everybody circle that one. That's really, really big there. When in terms of, laboratory and radiologic findings that you're looking for, there's a very specific type of almost a butterfly, but bilateral patchy, soft, fluffy clouds on chest x-ray you're definitely going to see. And then elevated procalcitonin levels, again, in most people, and they may not be super high, but it is a biomarker of infection. So you're definitely going to see that elevated.
Okay, now F, positive SARS-CoV-2 antibody IgG. That would tell me that I have been exposed to it and I have antibodies, but not an active infection, correct?
You got it. So that test, we're not really, checking that test if you're in the hospital and ill with presumed COVID, right? That's the antibody test afterwards. So in the hospital, we might look for a rapid antigen test, antigen, active infection, but not the antibody test. You got it, Alice. Got it.
And then G is a normal ABG. So I'm not going to be worried about that. I'm happy that that's normal. That means that there's probably not, my acid-base balance is pretty good. I'm okay with that. So that's not going to be an answer of suggestive of COVID-19.
You got it. Absolutely. Particularly that PO2 of 90 there at the end, that's good, right? That's high, normal. So we want it to be that way. That pH was 7.41, pretty much right smack dab in the middle. So that's good. Great question. Love it.
Okay, very good. Wow, y'all, those NCLEX questions really pull the life out of you. But
but that's how you work through the NCLEX, right? You just keep battling it out and go through them and figure them out. I promise you it's worth it.
Exactly. Now, Dr. J, let me just get into it real quickly. You are someone, so we know that the Pfizer vaccine was FDA emergency approved on December 11th. And then shortly thereafter, the vaccine became available. We know that Moderna has been approved and it's just getting to places like as of today and yesterday. But Pfizer vaccines, people are starting to get them, and you got yours. I saw it on Instagram. You were sharing, you were in, 24 hours, 36 hours, like you were keeping us updated. What was that like getting the vaccine?
It was really, I was of multiple minds with this. I think it was really interesting. So I, super excited. And I do work with COVID patients, every day. So as a hospitalist, I see quite a few patients, and more than half, I think when, my last couple of days on service, I had at least 60% of my patients were COVID patients. It's the surges that we're seeing in the hospital are very real. So I was, very, very busy, but also simultaneously very, very excited to hear about the vaccine. And my hospital was sort of like, it's coming, it's coming, it's coming, be ready. And then bam, they were just like, all right, ER, ICU, 2 COVID units, you got EVS, go. And then a message came out to all of us providers, so the NPs, PAs, and physicians, like 10 minutes later. And they were like, call this special number. We have ones reserved for you. If you work with a certain percentage of COVID patients on a daily basis, you're eligible for this. Like, you're going to be the first round. So I called. I had an appointment scheduled for the next day. And if you go on my Instagram, you can see I did a video through the whole process and how I felt, over the last weekend. And it was really exciting. But I got the vaccine, and then I went straight back to work because there was work to do, right? It was a sort of a very nursey moment, right? Like, I feel like we have these big things that have happened in our life or that happen with our patients while we're caring for them. And then we have other patients that we need to worry about. And so I just like went right back to work. And it was a pretty humbling moment, though, to be one of the first. I think I was among the first 100 people in LA County to get the vaccine, and definitely among the first couple of thousand in the United States. So it was pretty exciting.
Okay, let me ask a couple questions, kind of almost rapid fire. So you're at work, you're getting the vaccine. Just walk us through. So like, did you have to do like a long questionnaire? I mean, did you have to talk with the nurse about like allergies, medical conditions? What was that like?
They were really great. So there's a very specific CDC card that you get, right? And they're like, this is your vaccination record. Then there's also a bunch of paperwork. That was kind of like LA County Public Health Department and my hospital kind of combined, and it was COVID specific. And there were all these questions on there. Have you ever had allergies to this? Have you had anaphylaxis to anything else? Have you reacted to vaccines? All this paperwork. They're about 2 or 3 pages. You had to read the fine print, give them your health history, and the nurse was on it. You know, she was not playing. She came over and she was like, let's talk about your allergies. Let's talk about the medications you take. Let's talk about your underlying conditions. Okay, yes, I think you can do this. Fill out all this paperwork, and then like, beam, bam, boom. So it took probably 10, maybe even 15 minutes beforehand, but it was great. I'm glad she was very thorough.
Okay. And so then you get the vaccine. How long did you have to be monitored after you got the vaccine? Did you have to sit in a special area? Did you get cookies and apple juice? Like, what happened after that?
I saw a lot of places. A friend of mine who works at a hospital just down the street from where I do, they actually got hot chamomile tea and cookies. I thought that was a great idea. Yeah, they had like a whole waiting room set up and whatever. So I think because I was quite literally one of the very first people in my hospital to get it, they weren't quite set up with all that yet. So my office, where the hospitalists, where we all sit, is actually within eyesight of where they were giving the vaccines from in that conference room. So she actually said, go back to your office, work on some notes, and keep the door open so I can see you. So she actually was eyeballing me. She did have other people though in like a separate waiting area, of course, physically distanced and all that, watching people for at least 15 minutes afterwards, just to make sure that there was no reaction.
Okay, good. And so how far out are we from the vaccine now? What day?
So it was Thursday. So is that five full days? Friday, Saturday, Sunday, Monday, Tuesday. Yeah, 5 full days.
So what symptoms are you having, if any, right now?
Zero. Nothing. I will tell you, about 10 minutes after I got the vaccine, I felt flush for about 10 minutes. And it was a little scary, right? Even doing what I do and knowing, everything I know in the science, and, you and I both talk about the vaccine in the media repeatedly, oftentimes multiple times a day. And even then I was like, oh, I'm a little flush. What does this mean? Like, oh my gosh, what's going on? And I was like, James, don't panic, relax. You just had a vaccine put in you, like it's fine. And then about 10 minutes later, that kind of flush sensation went away. The next couple of days, my arm was sore, like a flu shot, but even just a touch more sore, I will say. I think she really got it in that deltoid. She got it good. But then other than that, that was really it. And my arm's totally fine now. It's like not sore at all.
Okay. Well, that's good to know. That's reassuring, because I think a lot of people were afraid. And, again, part of this show and this platform is to talk about anything and everything COVID-19 and vaccine, and kind of put some fears to rest, to demystify some rumors and propaganda and things like that. Absolutely. And so you got the vaccine and you didn't like wither away. You're doing fine.
I always tell people, I did no third eye, third arm yet. And I know, listen, I know we're worried about sort of the longer term aspects of this, but mRNA technology, and I know you're going to talk about this more in Nurse News Now in general, Alice, but mRNA technology has been around for a while. The actual technology itself has been around for more than 30 years. We've actually been trying to use mRNA to make a vaccine, primarily for Ebola beforehand, but for other viruses for more than 10 years. And safety protocols were not, I was as concerned about this vaccine as I think everyone else was, but I took my time to do my research and to really look into the safety protocols that they went through, the data that was finally released. I really took a look at that. This was really important for me to understand what my sort of risk benefit ratio was in taking this vaccine. And I think it's really safe. I don't think I'm going to grow a third arm. I don't think I'm going to have, other adverse reactions or side effects or anything that are going to happen down the road. And I really am an advocate for this vaccine now. And I will definitely have to check in with you and let you know how I feel after the second dose.
Yes. And so again, you got the Pfizer vaccine. Speaking of second dose, so you're going to come back in 21 days. Did you get a reminder, any type of paperwork, or did you register online for any notifications? Was there anything else that we should be aware of or familiar with?
Sure. I thought this part was really interesting. So I got on my CDC card, it's the, like we do with vaccines, it's the lot number and the very specific one and who gave it and where and all that. It was all listed there on the CDC card. And then I got a reminder to come back in 3 weeks, like a paper reminder. I didn't have to register online or do any process like that. I don't know. And I felt like I should have asked and I didn't. I don't know if I'm going into an electronic database. What I do know from sort of like higher level discussions of conference calls I've been on with the county public health department here is that, obviously LA County Department of Public Health is tracking all of this here. So my guess would be, I don't want to make assumptions, but my guess would be, there's mandatory reporting that has to happen from hospitals as to who got the vaccine up to public county health departments, state level, and then nationally. So I imagine whether I've registered for something or not, which I haven't, I'm in a database somewhere as someone who's gotten at least one dose of this vaccine.
Yes. And just to comment on that, I've sat on Governor Newsom does these weekly town halls where he talks about everything. And at least here, I know here for California that they are closely monitoring not only how many vaccines are administered, but where they are administered, and to whom they are administered. And this is to prevent people from jumping the line. They really want to make sure that the vaccines roll out in the proper sequence to the proper groups. That way it eliminates any potential for kind of, the rich and the affluent who may be totally healthy and young from jumping the line in front of the elderly person who's 75 years old with multiple medical conditions who's supposed to get it before them. So I was told that we're watching them. But also, Jess, I just want to throw it out there. And I believe you can register for this. And for people who are watching, if you don't know, as nurses, it's going to be very important for us to know this information as well. There is something called the V-Safe. We're going to try to put that in the comment box. But V-Safe is it's an app that you can put on your phone, guys. Let me say it is a smartphone-based tool that uses text messaging and web surveys to provide personalized health check-ins after you receive a COVID-19 vaccine. So through V-Safe, you can quickly tell the CDC if you're having any side effects after getting the vaccine. And depending on your response, you actually may get a phone call from someone from the CDC and reminders of when to come back for your next vaccine. So things are just rolling out. We know that things can be slowed on the uptake, so we've probably not heard a lot about this. But you, as a nursing student, nurse, advanced practice nurse, retired nurse, this is information that we need to know so we can equip the community. It's called V-Safe, and we're going to make sure that that gets into the chat box. Actually, I should probably be doing that now.
That sounds awesome. I'm going to sign up for it. That's great.
Well, it is. And I think it's one of the things that, it's another added tool. We're always on our smartphones anyways. So, hey, why not do it? Okay, so absolutely. I'm going to put it in the chat box there. Guys, it's a CDC smartphone-based app. So check it out, okay? But I think you can't register until you actually get the vaccine. So anyways, but wow, thank you so much for sharing. First off, going through that hard NCLEX question with us, because that's really hard. Also being brave and being one of the first to get the vaccine and not being afraid to tell your story, because I think hearing our colleagues and our friends and people we know, first accounts of what was the vaccine like, what are you experiencing? I think that's very helpful, because many of us, I'll be honest, are afraid. We're frightened because we feel like the technology came too fast. And you gave a great explanation earlier about how we've been working on mRNA vaccine for quite some time. So it's not as new as people think. We just haven't been talking about it as much. And I believe this is the first commercial version of it. So,
right.
yeah. So
absolutely.
Thank you so much for your time and chat.
It's my pleasure. I'm privileged and honored to be here. I'm also privileged and honored to have been, one of the individuals who got this vaccine. I know that it's kind of a big deal. And yes, I've been, on the front lines of COVID for a very long time at this point. But I do also feel, I still feel privileged as a nurse and as a nurse practitioner in a hospice to be able to care for patients, regardless COVID-19 or not. And so, I'm just honored to be here, share a little bit about it. And I encourage everyone, if you have questions, like that's why people like me and Alice are out here, ask those questions. I would rather you have those questions and ask them, and we can try to answer them for you. So I'm happy to be here, Alice. Thanks for having me.
No, we appreciate you. And by all means, I'm going to say this to everyone. Although there's almost 4 million of us nurses, we need to preserve our nurses, because in the grander scheme of things, when we look at the health professionals who are getting sick with COVID-19 and who are being hospitalized, nurses by far are the most, are the health professional role of that is being most impacted negatively by COVID-19. And it kind of makes sense. We're 85% of the healthcare workforce. So we got to be there. So James,
absolutely.
Thank you so much for being a part of it. I'm gonna pull you back in for Nursing Now every now and then, because I really think you're a really great guy. Guys, please make sure to follow Dr. Smith on IG and Twitter, Ask the NP, and go to his stories. He does tons of reels. He's gonna keep us on his COVID vaccine journey, and we'll see him at a week, full week, 2 weeks, 3 months, all that stuff later, and you'll see he still will not have a third eye. Okay.
Very good. Thank you, Nurse Alice. I really appreciate it.
Thanks, James. I appreciate you.
You got it.
All right, guys. So that was Dr. James Simmons. Thank you for joining us and sharing his experience. I thought that was very important to share the first account of getting the vaccine. It's scary. Some of us are afraid to do it. I was on I've been reading a lot of stuff, a lot of webinars, trying to stay current and ahead of all of this information, COVID, everything. And, there have been several surveys out there, and there was a survey from the American Nurses Association that said a third of nurses are definitely gung-ho about getting it. A third of nurses were like, I don't know, kind of in the middle. And a third of nurses were like, I'm not getting it. So, and this was concluded back in end of October, published early November. We'll see how the numbers change. I will say this, getting a COVID vaccine, and this is not just for nurses, but this goes for everyone. If you are not doing 100% of everything, you are contributing to our world pandemic. You are. I said it. I did. So it's going to be very important, especially with the holidays coming. People need to be staying home, wearing their masks, social distancing, avoiding large crowds, all of those good things. They need to do those things because, guys, if we were able to stay home and quarantine and limit that, we would limit exposure. If you limit exposure, you limit transmission. If you limit transmission, you will limit COVID-19. So it's because our nation was not great at that we needed to elicit the help of other medications and treatments, which is now why we have a COVID-19 vaccine. We have no one else to be upset with but our very own nation as to why we were put in the position of needing a vaccine. And speaking of needing a vaccine, I think we're going to go ahead and talk about something else that's been very important and on the top of people's minds are these allergic reactions. Well, let me back up a little bit. Let's talk about side effects, right? Side effects we know are they are known effects of the medication. We anticipate that will happen. They are a nuisance. We don't like them, but we anticipate that they may happen to individuals. And we know from the studies that 10 to 15% of study participants encountered side effects of the vaccine. And I believe I have a photo up that I'm going to share. Do I have a photo up? I do. Let me show you this. This is a side-by-side picture of the COVID-19 vaccine. We have Pfizer on one side, Moderna on one side. Let's just go ahead and review this slide. We know that both vaccines are two-step processes. Guys, just like we tell our patients, make sure to finish your course of your antibiotics, even though you're feeling better, right? Make sure you take both doses of your COVID-19 vaccine. Now you'll see on that slide that even after one dose, your body will start to develop immune response, and there will be somewhat effective. How long it's effective, we're not quite sure just yet, but there's some effectiveness, but definitely much higher after the second vaccine. I believe with Pfizer, that's 7 days after the vaccine. And then with Moderna, 14 days after the vaccine, they should have, 95 versus 94.5% effectiveness, which is good, right? It's better than nothing. We also know that the Pfizer vaccine is approved for people who are 16 years of age and older. The Moderna vaccine is for those 18 years and older. They have very, very similar side effects, a little pain at the injection site, some fatigue, headache, joint pain, muscle pain. With Moderna, you may have some chills, and with Pfizer vaccine, you may have a little bit of fever. Those are anticipated side effects. If we inform our patients, neighbors, colleagues, friends, family about these side effects, then they will be aware that they exist, and they won't then say, oh, the COVID vaccine gave me COVID. Because if you realize some of these side effects are overlapping of some of the COVID-19 symptoms. And so what do we say to people about these side effects? Well, they're generally short-lived. They will dissipate by day 2 or day 3 at the tops, right? And so they should be gone by day 2 or day 3. If they last beyond that, or they start to develop other symptoms, such as runny nose, sore throat, loss of taste or smell, some GI symptoms, shortness of breath, those are not side effects of the medications, but are symptoms of COVID-19. So those are very distinguishing factors. So when talking to your patients, those are things that you'll want to mention when it comes to patient education, okay? What are the side effects of the vaccines? And if they're experiencing beyond day 2 or day 3, also coupled with some of those others that I just mentioned that actually might be COVID-19. And it could be that they may well came in contact with the virus immediately prior to getting the vaccine. So, but because of the mRNA technology we're using, it is not possible for the COVID vaccine to give someone COVID-19. It's not a live or attenuated virus. It's not even a whole protein. It's mRNA technology. So that's something that's very important for people to know. Just kind of a little trivia for nurses, just so you all know. People are going to ask, which is better, Pfizer or Moderna? Pfizer or Moderna, right? Listen here. When this vaccine becomes available, and if you are eligible and desire to have this type of protection, the best vaccine is the vaccine that's most readily available to you. Facts. It is. And I can just tell you this, Pfizer, although it was the first to be approved under emergency use, it is a lot more difficult to store, right? You have to, it needs to be stored under ultra cold temperatures. The minimum order is extremely large, like 975 vials. So that and the ultra cold storage makes it very difficult to be in places other than large academic institutions that have the ability to store things like that. Your small pharmacy, your small family clinics, your rural areas are not going to have this type of storage, which is why Moderna is going to be a really helpful piece to this puzzle, because with Moderna, you can store it in the normal freezer temperature. And, once you thawed, it's good in the refrigerator for 30 days and those type of things. And if you go to nurse.org, there's actually a great article on the website that talks about the differences between the COVID Pfizer vaccine and the Moderna vaccine. And I want to encourage you guys to make sure to check it out. It will go over into these very details that I'm just talking about. But as nurses, students, these are things that people are going to ask us. We wanted you guys to have a forum where we can just talk about it. I mean, I know your employers have information and things like that, but this is the place where you can hear things and maybe hear them over and over again, hear them different ways. So you feel more comfortable and confident about it. And you can have a chance in a very safe environment to ask your questions about these vaccines. So let's see what else is next. Something else that we're going to talk about. I'm going to go ahead and take that off the screen. Who should and who should not get the vaccine? How about that? Well, I think, and let me say this, peer pressure should never be a mechanism in which we use to encourage patients to take a medication, to follow a treatment plan. Intimidation, fear, those are not techniques that we should be using. Not at all, not in the least. The best thing that we can do as healthcare professionals is to be transparent, to be honest and to provide people with enough information so they can make informed decisions. Your health is a very personal decision. So I wanted to say that. I forgot to say that a little bit earlier, but let's talk about it. Who should not take the COVID vaccine right now? I think this is a very important question. And the truth of the matter is, if you don't want to take it, you don't take it, right? But that's not where I'm going with this. Where I'm going with this is the FDA recommendation. So FDA has recommended that if you are someone with severe anaphylactic type allergies to any of the components in the COVID-19 vaccine, that you should not take this vaccine. Now, we know that there have been 6 people to date in the United States who've experienced severe allergic anaphylactic type reactions to the COVID-19 vaccine. And as a result, the National Institute of Health is rushing to devise a study to discover why this is happening. There's actually a component that, it's still early, so I'm not going to say what it is. They believe there may be a certain component in the vaccine, which is both in Pfizer and Moderna, that may be triggering a hypersensitivity response. We got to let this unfold. It's just breaking news, so I'm not going to fully report it out now because it still needs to be vetted. We're still learning more. But if that's the case, we know that with every version, batch of vaccines, they get better and better and better. And this is why it's very important for people when they get their vaccine to make sure that they stick around at least for the 15 minutes for the people who don't have any allergies, up to 30 minutes afterwards if you're someone with allergies. And in fact, if you're someone with severe medication and food allergies to other drugs or foods like myself, it is actually recommended that you get your vaccine at more of a hospital setting, a place that does have resuscitative equipment. And the CDC has required that all vaccine administration locations be equipped with a minimum of medical devices. So, for example, I believe medical devices and medication. So, for example, I'm going to throw this up on the screen here. You can see there that this is from the CDC's website. If you're going to be getting your vaccine, or maybe you're someone who's going to be administering a vaccine, your facility, that site that's giving the vaccines, should have an epinephrine prefilled syringe or an auto injector. They should have some type of Benadryl or antihistamine there. They should have a blood pressure cuff, stethoscope, and a timing device to assess the pulse. So I'm like, maybe like a pulse ox to check the pulse, or cardiac monitor, or something of that effect. Other things that should be there: pulse ox, oxygen, maybe some bronchodilators like albuterol, some other antihistamines, H2, IV fluids, an intubation kit, and CPR mask. So those are the latter list is not necessarily required, but it's strongly encouraged because we're seeing more people have allergic reactions. And it's important for people to know, nursing students, let's make sure, even if someone does not have a documented medication allergy, many of these people are adults. They haven't gotten vaccines in a long, long, long time. So they don't even know. They could be very well allergic to a vaccine that's created and not know it because they've not been put in a position to even experience any allergies, if that makes any sense. So it's going to be very important that you encourage people that when they go, to stick around as long as they can, right? Let them know that the reason why they have to stick around, because people are like, I got somewhere to be. Most severe anaphylactic reactions occur within the first few minutes. So that's why between that first 15, 30 minutes, the more severe allergic reactions typically happen during that time. At times you will have delayed reactions, and those delayed reactions will be more of a skin sensitivity, rashes, a little bit of inflammation, but perhaps nothing where it's airway impacting. But those type of delayed reactions can occur anywhere for several hours later to up to a week, or maybe up to even 2 weeks later. So it's going to be very important that people are monitoring any changes, anything that's different. They need to document that as a side effect. They need to document that. So whether they're doing it through that app I told you about earlier called VSafe, or whether they're telling their healthcare provider, or perhaps there is also called a vaccine adverse event reporting system. That is a national safety vaccine monitoring system that's run by the CDC and the FDA that collects and reports data from healthcare professionals, manufacturers, and the public about any type of adverse events that have happened after the vaccine. Even if they don't know if it's directly related to the vaccine, but they feel that it might be related, they can report. We're going to go ahead and I'll make sure that we put that link also in the chat box so people are familiar with what that is. I think these are some helpful tools that, we should all know about. You're not required to know all these things by memory. I mean, I have my computer up. I have notes in front of me, guys. So don't, I'm just want you to know that it's okay. There's things about what to know and where to know to look things up. And I want y'all to know where to look things up. So I'm going to put in the chat box the that adverse reporting system, so you are familiar with that. When you go back to this live, let me bring so y'all can see me. When you come back to this to watch this, this is going to be a very helpful tool because we've talked about signs and symptoms of side effects, allergic reactions, differences between the vaccines. We've talked about allergic reactions, but we've talked about some of the stories that are out there in the news, demystifying those things. But the one thing I didn't get to, but let's go ahead and answer, and we'll end with this, and I'll try to get to some questions that you may have. Who should not take the vaccine right now? So we said people who have known severe reactions to any of the components of the medications, not for you. Now, if you are someone who has severe allergic reactions to any other food or medications, you definitely need to talk to your healthcare provider to decide if you still need to get it, because you might have some other pre-existing medical conditions that put you at risk for complications of COVID-19. So you might say, you know what, I kind of need this. And if you do need that, best believe you are someone who needs to take that vaccine at a more hospital-like setting that has resuscitative equipment, and you need to stay there at least for 30 minutes, right? But you got to decide if you're going to get it or not. Pregnant women and women who are lactating, there's not enough evidence or research to say that the vaccine is completely safe for you and baby, or will have any impacts on baby. But there's also not any evidence that says that it's harmful to your baby. So that's a conversation for you to have with your OBGYN and your healthcare provider to determine if this is something you need. Again, it'll depend on your risk factors, right? It'll depend on your risk factors. Are you at the front lines, or are you someone who can work from home? So those are things that you'll want to talk to your healthcare providers about. Also, if you are someone who is severely immunocompromised, maybe someone's undergoing chemotherapy for their cancer, they may not necessarily need to take the vaccine at this time, maybe later, but not now. Anyone who has an active infection, if you're actively dealing with COVID-19, not for you right now. You need to resolve the COVID-19 infection. However, it's a mixed bag still. Talk to your healthcare provider. If you're someone who's had COVID-19 and they estimate about 3 months after resolution of that, you will still likely need to get, should get the vaccine. That's what they've said. They've used this 90 days as kind of a rule of thumb. So, because people are going to ask you, I've had COVID, I should have antibodies. Do I need to get the COVID vaccine? We are unsure how long natural immunity lasts. So it's going to be important to add vaccine immunity when all possible to try to, again, prevent from getting COVID again, because we know that COVID there are known cases of people being reinfected with COVID-19, and we're not going to get it tonight because we're going to let the stories pan out a little bit more. But on the horizon in the UK, they're talking about a new strain of COVID-19. Yes, it's a strain that's had some mutations, and some of those mutations are impacting the spike protein, and our vaccines work because of how they work on the spike protein. So that potential new strain could be problematic. We don't know yet because our vaccines are just starting to roll out. And then kiddos, if you're someone with a child under the age of 16, there is no vaccine for them right now. So Pfizer for 16 and up, Moderna for 18 and up. Researchers and pediatric epidemiologists, they are working hard on a vaccine for children. They anticipate that they will have something for ages 12 and up by early fall. That's the best I got. That's all we got right now. That's the only time frame. So if you are a parent and wondering about your children, the best thing, kids should be schooled at home. There shouldn't be any group sports or activities. So that there helps protect them as well. We got to be good on our protective measures to, again, if you can prevent transmission, you can prevent the spread, you can prevent the disease. And that's one of the best ways that we can do that in the absence of getting a vaccine if you're not eligible to get a vaccine right now. Guys, oh my gosh, I'm all COVIDed out right now. We've been talking about so much COVID-19 and vaccines and all this stuff. I'm like, my head is spinning. Let's see. But this has been some good stuff, some great conversations. I hope this has been helpful to you. I hope you guys reshare this with folks. And I hope you take an opportunity to click on the links that I've added in the chat box so you can use that information and share it with your patients. Because again, I know people are asking you. I get asked all the time. And so COVID's new. We're all learning it. It's not like diabetes or hypertension where we learn this throughout nursing school and we're seeing it every single day. We didn't get this kind of study prep for COVID-19. It was just like, bam, we're here. It's here. Now we're dealing with it on the front lines, trying to learn concurrently and do our best, and while we're trying to be safe. So, guys, these are this has been a great conversation. Let me just run through these the questions to see if anybody has any questions, any other questions about the vaccine. Where do you recommend nurses research the vaccine? So guys, I would say, nurse.org actually has some great articles that you can start with there. They're nurse-friendly reads. I would say that. And then also CDC, great website to go to. We've put some links in the chat box. Please make sure to check those out. But this information changes almost daily. And there's no alerts that it's changed. It's just changed. So you go to the website and you find out that it's changed. But we've put some things here in the chat box. I want to say thank you to people who joined in. I know we didn't get to everyone's question. Thomas, thank you so much for being a part. You said you have a chronic CRP, always elevated, been to Mayo, 3 joint replacements in the last 3 years for loss of cartilage. I'm a nurse at home, not working. Do I need to get the vaccine sooner or wait? You know what, Thomas, that is a great question. I would say that would be a conversation for you and your healthcare provider, because with all of those issues, it might be challenging for you to kind of get out to a site to get the vaccine. And I know that some states are working on mobile, being able to administer vaccines mobile wise to get to hard to reach places and people who can't leave their homes. But I'm sorry you're going through that, but that'd be a great conversation for you to have with your doctor or nurse practitioner. Let's see. But I think that's it. And, we had some nurses comment on the nurse earlier. Let's see. Eudoxia. She said that maybe the process needs to be demonstrated in the presence of staff asked to see the vial. So she was referring to the nurse that used the empty syringe to give the immunization. I agree. Listen, I'm a patient. As a patient, you should be showing your patients what you're giving them, right? I don't open medications until I'm in front of the patient. So that's another reason why, our medication rights are so important, and that we include the patient in the process. We can eliminate medical errors. Yes, that's what I called it. Medical errors like that. So, okay, guys, this has been great. Lots of questions and comments. I hope you guys please reshare this video with your friends, your colleagues, your neighbors, things like that. Lots of great information here and tools for you to kind of start. Again, we're kind of building all of this COVID knowledge that's happening. I know I'm just going to real quick, the last question I'm going to get to. KM Hicks is asking, how will it affect, I think the word was going to be fertility. And right now we don't have enough information about that because pregnant women were excluded from the study. So we don't have the information, but I do know that Pfizer and Moderna have begun studies with pregnant women and young children already. So those are already in the works. So I hope in the next couple of months we'll get some information. But guys, again, to get really the answers we want, these are going to be very long-term studies. So some of the questions we want answers to, we're not going to get for quite some time. So, and that's why it's very important for us to be diligent. We need to be vigilant in our behaviors, and make sure that we're doing everything that we can do to protect ourselves, protect our neighbors, protect our family, and we'll get through this. We'll get through this together. So I want to say thank you To everyone who has tuned in, thank you in advance for sharing this with your friends and your colleagues. I want to say thank you so much to nurse.org. They're amazing. Make sure to visit their website. Tons of great information. You can visit nurse.org, have it up there as well. Follow them on all of their social media handles. IG, they are nurse_org, or their Facebook at /nurse.org. And I am your host, Nurse Alice. Thank you so much for taking the time to listen to me. You can visit my website for more information about myself at asknursealice.com. I am on all social media platforms, IG, Facebook, and Twitter at Ask Nurse Alice. Follow me, I'll follow you back. I do some cool things on there too. I share information and do some cool things. And then as well, you can also check out my YouTube channel at /Ask Nurse Alice. And on that note, I want to thank everyone for joining in the conversation. This is Nurse News Now with Nurse Alice here on nurse.org. Please, I want to invite you to stay tuned in and locked in every Tuesday, 6 p.m. Pacific Standard Time, 9 p.m. Eastern Standard Time. And we're going to keep the conversation going on COVID-19 vaccines and everything else related to it. So just know that there's a place for you to go to where you can get ongoing information. A resource, nurse.org, is amazing. And I'm not sure if I can share yet, but I can just tell you next week we have an amazing, amazing guest, and you definitely won't want to miss it. But we'll send some reminders and we'll share who it is. But until next time, guys, please make good choices, be kind to one another, and live well, my friends. Y'all take care. Bye.